Screening services in Swindon at the Great Western Hospital are offered to all new mums, and we recommend that screening is taking place as early as early as 8 weeks in pregnancy. It's offered to all new mums and is an optional service, so all mums will be asked to consent to the blood tests and screening tests that they're having. A lot of people don't know about these things and won't have heard of them, so I'm going to start at the beginning. We've got a screening timeline that will tell you when you should be having each of these blood tests, and also your community midwife will write them on your handheld notes and tell you when you need to come and see us. You can either have your blood test done with your GP, or you can have it done with your midwife at home, or you can have it done at the one-stop clinic here at the hospital, and I'll explain a little bit more about that to you later. The first blood test that we want to talk about today is a blood test for inherited blood disorders. They're passed from parents to children. These disorders are called sickle cell and thalassemia. You may not have heard of them. Anyone can be a healthy carrier of these disorders and never know that they're affected. You are more likely to carry unusual haemoglobin genes if your ancestors come from the Mediterranean, Africa, India, for example, Southeast Asia or the Caribbean, but anybody can be a carrier. This test is a simple blood test. All women are routinely screened for thalassemia, and then we will complete this questionnaire called the Family Origin Questionnaire. We will ask you and your baby's father where you come from. If any of the yellow boxes are ticked, that means you are an increased risk for sickle cell and will be screened. If we find out you do carry an unusual haemoglobin, we will recommend a blood test for your baby's father. To be affected by one of these disorders, you must inherit unusual genes from each parent. If the baby's father does not carry an unusual haemoglobin, the only effect for your baby was that they could be a healthy carrier like yourself. If your baby's father does carry an unusual haemoglobin, we will bring you up again to discuss this with one of our specialist team. If you're both carriers of an unusual haemoglobin, your baby has a 25% chance of having a haemoglobin disorder, and this can be quite significant for their life. We also recommend tests for hepatitis B, HIV, rubella and syphilis. These can be tested from one blood sample if you consent to it, and they're offered to help protect you and the health of your baby. These infections may not make you feel ill, but they can cause serious damage to you and your baby. These results are confidential, and consenting to the test does not affect your insurance now or in the future. Hepatitis B is a blood-borne virus that most women who are carriers will have caught from their own mothers at birth. You can also become infected by having sex without a condom with someone who's a carrier, sharing needles when injecting drugs, having a tattoo or body piercing, and even having a blood transfusion while abroad on holiday. Women who have hepatitis B can pass this to their babies, and they will be carriers for life, with over a quarter of them developing serious liver disease. But if we know that you're a carrier, we can offer the newborn a course of vaccinations from birth, and this will significantly reduce the risk of the baby being affected if they complete the 12-month course. We can also ensure that you are referred to the appropriate specialist for your condition to ensure that your health is improved. HIV is another blood-borne virus that can be contracted in the same way as hepatitis B, and in the same way can be passed on to your baby while you're pregnant or giving birth. If you are found to be a carrier of the HIV virus, you can receive medication and specialised care that significantly reduces the risk to your baby. This same treatment will also keep you in better health. Syphilis, although rare in the UK, is a sexually transmitted disease and is also a recommended test because of the serious effects it can have on you and your unborn baby. It can be cured by an antibiotic treatment, which will also treat the infection in the unborn baby. The baby will also be offered antibiotics at birth. If it is passed on to the unborn baby and left untreated, it can cause miscarriage or stillbirth and even serious illnesses in the newborn. Rubella or German measles is spread very easily from one person to another person, usually in the air. It is usually a very mild disease and not always possible to tell if someone has had it. The blood test in pregnancy is not to tell if you have the infection, but rather to tell if you are protected, as lots of women have been vaccinated against rubella at school. If you are not immune, you will be offered an MMR vaccine after your baby is born, and this will protect you in your next pregnancy. All pregnant women in England are offered screening for Down syndrome in pregnancy. Down syndrome is a chromosome disorder, and no two people with Down syndrome are alike, but generally they have learning difficulties and some health problems, including cardiac problems, and some loss of hearing, vision, and some physical disabilities. People generally think that only older women can have babies with Down syndrome, but actually anyone is at risk of having a baby with Down syndrome, and it does not usually run in families. Individuals with Down syndrome have an extra copy of chromosome 21. This extra copy cannot be removed from the cells, so there is no cure for Down syndrome. It is not caused by anything the parents have done. Only you can decide if you should have a screening test for Down syndrome. The test that you are being offered will not tell you for certain if the baby has the syndrome, but rather if your baby has an increased chance of having the condition. These tests carry no risk to your pregnancy. If we find you have an increased chance of the baby having Down syndrome, we will offer you a diagnostic test which will give you a definite answer. The reason diagnostic tests are not offered to all women is because they have a risk of miscarriage, which is approximately 1%. It is your choice if you continue on to have a diagnostic test following an increased risk of screening. Think of screening like climbing a ladder. The further up the ladder you go, the better the view is, but it isn't without its risks. Do you want to start climbing the ladder if you aren't going to go to the top? Some women feel that because they would not end the pregnancy if it was affected with Down syndrome, there's no point in starting the journey. Other women feel that although they will stop at screening, even if they have an increased chance, they want the time to prepare for the possibility that the baby could have Down syndrome. In Swindon, we offer all women the combined test in early pregnancy. The combined test uses the results of a blood test from mum and an ultrasound scan to calculate the chance of the unborn baby having Down syndrome. The combined test is like a jigsaw puzzle, in that the more information, the more pieces that you have, the better the picture. We will ask some information from you, plus a measurement of scan fluid from behind the baby's neck and 2 blood markers that are in your blood to tell you the chance of your baby having Down syndrome. For example, 1 in 100. This is a 1% chance of the baby being affected with Down syndrome. This blood test has a greater than 90% detection rate, meaning that we will find more than 90% of babies with Down syndrome that have an increased chance. If you are in the recall group for this test, meaning that you have an increased chance of your baby having Down syndrome, you will be contracted by one of the screening midwives within 7 working days. If you have a low risk or low chance of having a baby with Down syndrome, you'll receive a letter in about 2 weeks. Remember, low risk does not mean no risk. So your baby could still be affected with Down syndrome if you have a low risk. The test is done between 11 weeks and 13 weeks and 6 days. If you are further on than this in your pregnancy, you will be offered a quadruple test. This can be carried out up to 19 weeks and 6 days of pregnancy and is a blood test from yourself that look at specific blood markers. The detection rate for this test is slightly lower than the combined test, but is still a very good screening test. All women will be offered a further scan to check for fetal abnormalities. This is called the 18 to 20 plus 6 week scan, or the fetal anomaly scan. The main purpose of this scan is to check for abnormalities in the unborn baby, and as with combined and quad testing, is a test that you should consider carefully before consenting to. We usually learn that the baby appears healthy and developing well, but sometimes we find a problem. If this happens, it will be explained to you and further investigations will be offered. For the vast majority of pregnant women, screening tests will be negative or low risk, but for those women who do have an increased risk chance of having a baby with a problem, we have a dedicated screening team at the Great Western that will talk you through the process that follows this.